Hello, let's begin today's module. Now, right now I'm going to talk about orchitis. What is orchitis? It's an inflammation or infection of the testes. Okay, so what really happens is whenever testis is infected or inflamed, whatever, it also involves epididymis. So I had talked about this section on epididymitis, acute epididymitis. Okay, so this can orchitis or infection of testis, infection of the epididymitis can occur together. Okay, both can occur together. It's known as acute epididymo-orchitis, and when it becomes episodic, it occurs over and over again, it becomes a chronic epididymo-orchitis. Right? Chronic epididymo-orchitis is most common in the elderly individuals where they have recurrent UTIs, urinary tract infections, due to prostate problems, and they have urinary tract obstructions, and they have this infection being occurring over and over again. But in acute orchitis, let me share the screen so I will be able to distinguish you better, explain you better. So what really happens is this is the scrotum, this is the testis, okay, and this is the epididymis. Okay, fine. This is the epididymis. So whenever there's an infection, the most common cause of infection is sexually transmitted infections. Okay, how does it come in the testis? The most common is a retrograde flow. So what this happens is vas goes to what is known as urethra. Okay, so there's a urethra, there's a prostate over here, and there's a bladder over here. The above thing is the bladder. So the spermatozoa comes over here, is being produced, as I said, by the seminiferous tubules. They pass transport to this epididymis, vas deferens, spermatic cord. Spermatic cord is the big thing over here. It contains houses a lot of things. As I said, blood vessels and fats and lymphatics and testicular arteries and all these things. And it goes to the urethra. And this is the penis. Okay. So ultimately the sperm comes over here and the discharge during ejaculation. Same thing now. It may happen is that the patient may have a urethritis, an infection of the urethra, have an infection of the prostate. So the microorganisms can reflux. What is reflux? They can backtrack. They don't come from here. They just backtrack into this channel, and they go infect the epididymis, infect the testis. Okay, fine. So orchitis, the infection of the testis becomes the orchitis, infection of the epididymis. Both can occur together, epididymal orchitis. So one of the most important cause, as I said, is bacterial infection, and it's mostly these are sexually transmitted diseases. Second is viral orchitis. This is more common in very young individuals. They have a mumps orchitis, and they can also have a mumps infection. They can also have a mumps orchitis. Okay, so in this case, so we don't have much treatment for mumps orchitis, isn't it? So just if the patient has pain, you can just give some cold ice packs and just elevate the testis and give him analgesics, plain and simple. And if they have the bacterial infection, if they have, these patients have high fevers and very severe pain, you have to admit them and give him intravenous antibiotics, because often what happens is oral antibiotics may not be, it's good in the early part, but later part, because testis being a very vascular, because there's a lot of arteries going in, a very precious organ. Na? So if the infection persists for some time, there will be what a process is known as suppuration. What is suppuration? Is pus formation. So whenever there's a pus formation, testis becomes very difficult. So then you have to operate in the patient, because the pus doesn't drain by itself. You have to drain the pus. You have to operate on the patient. A young patient, surgery on the testis often leads to testicular damage. So it's very important whenever you're having fever, chills with chills, and you have severe constitutional symptoms like headache and malaise, and you're having this testicular pain in the testes. Okay, and you can't touch, the skin becomes very red, and that scrotum becomes swollen. So be wary of the fact that you can be suffering from infection of testis plus minus epididymis. So you must take you must take an expert consultation at the earliest opportunity. So you can do this, a lot of tests are there, and as I said, so we'll talk up to this. Okay, this is basically an orchitis, and you will have another section on epididymis. So you just combine together, what is this? This is a more of a important thing, epididymal orchitis. Okay, so that's for this module, and I will be meeting you again. So in the meantime, if you have any question, just write in the comment box. Okay, we'll be coming back to it. Bye bye.